Hello, everyone, and welcome. So happy you're here today. My name is Gary Parker. I'm the Associate Dean for External Affairs at the Brown School at Washington University in St. Louis, where I also have the great privilege of directing the Clark Fox Policy Institute. And welcome to the Brown School's three-part series, Supporting a Healthier Missouri. And today, part one, Medicaid expansion and racial equity. Today's event is co-sponsored by Forward Through Ferguson, CareSTL Health, and the Clark Fox Policy Institute, and it's going to be a very engaging discussion. We have the convergence of two public health crises, COVID-19 and racism, and they are shining a light on the profound health disparities in our state and coverage gaps that are disproportionately impacting people of color. And today's panel will explore how expanding Medicaid in Missouri would be a tremendous step towards alleviating the disparate health burdens on poverty-impacted Missourians, and especially tens of thousands Black and Brown residents in our state. This is part one. We have two more parts coming up. We have part two, Medicaid expansion and rural communities, which is co-sponsored by the Center for Health Economics and Policy and the Clark Fox Policy Institute. And part three, Medicaid expansion and family well-being. I will put a link in the chat feature so that you are able to register for those events. Also, after they have been broadcast, they will be posted to the Brown School's YouTube page. So if you aren't actually available to join us on the day of, you can engage in this conversation and the information afterwards via YouTube. So we have two guest speakers who are going to kick us off and give welcoming remarks. So we'll start it with the Nidor Family and Centene Dean Corporation Dean of the Brown School, Dr. Mary Mckay. Welcome, Mary.
Thank you, Gary. And thank you to all our panelists. I want to acknowledge Dean Perlmutter from the School of Medicine, my colleague and fellow dean. And I think I can say we, David, are really delighted that you're here. So I want to just make some, points around facts and science for just a minute to start us off. That we are at the place in Missouri where we're having a rigorous debate around the importance of Medicaid expansion and what it can do in our region, across our state, in terms of eliminating health disparities, and particularly those that are predicted by race. And you have a set of panelists that have very strong opinions that are based in fact. And that's what I want to ground us in terms of the science that's coming out of Washington University, but across the nation around Medicaid expansion. So we had two colleagues and two faculty members and their colleagues at the Brown School who worked on the science behind Medicaid expansion. Mikel Whittier and colleagues, Tim McBride, Abby Barker and colleagues, and they identified that Medicaid expansion would do a tremendous amount of good in terms of minimizing the risk of personal bankruptcy and high medical debt. Tim McBride recently testified in Jeff City around the models that this would not burden our state, but in fact help us economically. There's lots of evidence coming from across the nation that what we call the ACA, the Affordable Care Act, that has an ability to narrow racial and ethnic disparities. Incredibly important studies come out to see the elimination of disparities by race around infant mortality when there's an opportunity to expand the support for healthcare. And I could go on with some of the other advances, but when you hear David powerfully talk, as he typically, or some of our other panelists, know that underneath those words are a lot of science to suggest that Medicaid expansion has good data and support for driving outcomes, particularly around advancing racial equity. And so I'm really happy to also turn this over to Dean Perlmutter. David, your hospital, your School of Medicine, you as a healthcare provider, there's so much that you might be able to do with an expansion of Medicaid. And so I'm incredibly happy that you came out in front with our Chancellor, Chancellor Martin, and really advocated strongly that this is important for the patients that you care about, for our communities in our region, and an important policy decision. So thank you so much for your voice, and we appreciate you. David, please.
Thanks, Mary. And I want to thank Dr. Parker and Gary and Cynthia for doing this. It's an exquisitely important moment. And I want to make a couple of comments to follow on Mary, which really represent the leadership of the university and also our work with our partner BJC Healthcare and how we have worked on this. I began working with government relations and the chancellor a year and a half, 2 years ago, and every reason that we began working on playing as much of a role as we could in this campaign has been exaggerated by the recent events in this country in very dramatic ways. So, and I'll say what those reasons are in a moment, but just to say to you that over the last 3 months, we have experienced 2/3 of the patients that are in our emergency room and in our ICU with COVID-19 are brown or black, and that has dominated what we see, and the viral outbreak has exposed all of those things that have led to the problems that pre-existed and the problems that were to be addressed by the Affordable Care Act and the Medicaid expansion part of that. So those reasons basically were that we know from how it was designed, and then since 2014, in which many states adopted the Medicaid expansion, that it improves access, it improves outcomes, we now know, and it improves the economy of the state. And I would also go further in saying that this is the first step in a systemic way to address wealth inequity in our country. So all of those things were reasons for us to, as a university, play a leadership role. And of course, not only has the virus exaggerated this to the nth degree, it also has, through the unemployment and the financial disadvantages that have affected every aspect of our society, it makes it even more important. And I'm so glad we are now 19 days away. A year and a half ago, I must admit to you, government relations said, David, I'm not sure you want to do this. You might be disappointed. And now I feel like we're really, really close, and we got to get everybody out to vote for this. I want to just end my remarks by saying that, and I'm just reading from an op-ed we just submitted. Not only is this the right thing to do for so many who lack access to healthcare, but I can't think of anything that could more quickly transform the economic outlook of St. Louis, its surrounding counties, and the state of Missouri. But I want to emphasize that this really is only the first step in many things that we have to do. But of all of those things, this is the one that is most proximate. This is the one that is most possible today. Our polling numbers make us believe that it's possible, and I don't want anybody to relax. But thank you all again for having this conversation and being interested at this really exquisite moment. Thank you.
Thank you, Dr. Perlmutter, and thank you, Dean Mckay. We so greatly appreciate your leadership on this issue, and so grateful that the university has taken such a strong position in advocating for the expansion of Medicaid in the state of Missouri. Today's event is being produced as part of the Brown School's Open Classroom Initiative. I want to encourage you, and I'll put a link in the chat feature, to check out the many courses that are being offered for free. You'll get to have a guest lecture by one of the many faculty members at the Brown School, and they are always very engaging and enlightening. And I want to thank Janet Gillow, who is our Director of Professional Development, who has been working on that event. And I also want to send out a very special thank you to Atia Thurman, who's the Associate Director of the Clark Fox Policy Institute, for all the work that she has been doing behind the scenes to get this series up and running. And now I also would like to introduce my co-hostess with the mostest and a very dear friend of mine, Cynthia Williams, who's the Assistant Dean for Community Partnerships at the Brown School. Hey, Cynthia.
Hey, Gary. Good afternoon, everyone. It's delightful to be here with you. And thank you so much for lending your expertise to this important conversation. And as many supporters will agree, that Medicaid expansion will actually be a lifeline to many families and Missourians here who will be able to take care of their families better, pay their bills, go to work, get and stay healthy. And on August the 4th, we have an opportunity to become the 38th state to approve Medicaid expansion, and that will be an amazing, amazing feat. And I believe that we can do it. And so just to get right into this conversation, I'm going to go to you, Michael, and ask you, would you briefly explain what is Medicaid expansion?
Certainly. Thank you all. It's an honor to be here with such an esteemed panel and everyone here. But to your question, Cynthia, Medicaid expansion literally is just that. We are expanding the eligibility criteria for those who are unable to qualify for Medicaid, to expand that criteria so that they now are eligible for Medicaid. Under the status quo, what we see is families of three. It could be a single parent with 2 children or parents with 1 child. To qualify for Medicaid, you have to make less than $301 a month. For a non-custodial parent between the ages of 18 and 64, you have to make less than $3,600 annually. And so Medicaid expansion will expand the criteria so that now those making $18,000 annually can now have access to Medicaid. And so I want to be clear, this is not a welfare program of any sort. This is expanding access to care for those who are working really hard for us, especially during this pandemic. Those on the front lines, our personal care service workers, our food service workers, our nursing aides, our environmental staff, really sanitizing our organizations, our buildings. These are the people throughout Missouri who are working really, really hard, and this expands access to them. And this is really a step in the right direction to getting us towards equity around healthcare. This isn't one fix all solution, but a step in that direction.
Michael, thank you so much. And in my haste to get the conversation started, I failed to ask you to introduce yourself as well as the rest of our panel. So will you please do that, Michael? And then I'm going to ask Jen, David, and Angela to follow suit.
Certainly, no worries. This is certainly an important conversation, Cynthia, so I did not mind you jumping right in. Hello, everyone. I'm Mikel Whittier. I have the privilege of serving as the strategist of justice and health equity at the Integrated Health Network, but I also serve as the coalition's director for Yes on 2 Healthcare for Missouri. And so I am honored to really serve in both those roles, working on access to care for those right here in the St. Louis community, but for those throughout the state as well.
Hi, everybody. I'm Jen Bersdale. I use she, her pronouns, and I'm the executive director of Missouri Healthcare for All. We are a statewide permanent healthcare advocacy organization So we have been working on this issue since for 8 or 10 years, depending on how you calculate it. Thrilled to be at this moment and honored to be on this panel today.
Hi, everyone. It's so great to be with you all this afternoon. My name is David Dwight. I work with Forward Through Ferguson as the Executive Director and Lead Strategy Catalyst. We're the organization created after the close of the Ferguson Commission to continue on with that deep community work that engaged over 3,000 community members following the killing of Michael Brown Jr. And focused in not just on the incident, but what are all of the underlying conditions, whether it's in policing, health, housing, transportation, education, that prevent us from having a region that is thriving for everyone. Seeing the extreme gaps that exist for people of color, and especially Black residents in the St. Louis region. So it's been amazing to work with many of the people in this room in this work.
Thank you, David. Angela?
Good afternoon, everyone. My name is Angela Claybon. I am the CEO of CareSTL Health. I am excited to be part of this panel. I am excited about the Medicaid expansion. I have worked in federally qualified health centers or the community health center movement for about 38 years. For us, I live in North St. Louis. And as stated, the Medicaid expansion will be a great financial impact for our community. So I'm glad that you all have me sharing my little knowledge that I have here. But this is a great time for the city of St. Louis and the state of Missouri. So thank you for having me.
Thank you. And another question I'd like to direct to the entire panel, and that is, how has COVID-19 changed how you see the importance of Medicaid expansion?
Well, since I'm unmuted, I guess I can start there. It has changed a lot. For us as a healthcare center, the Federally Qualified Health Center, we have received funds to actually test individuals for the virus and before the virus. Some people may have forgotten, but for us, we were fighting for resources and doctors and nurses to actually come to North St. Louis and to work for our health center and to work in this community that is very blighted. We talk about the racial inequity. So we were in that struggle before COVID. We were in the struggle of the opiate pandemic before COVID and in the struggle of the high crime. So with that, we were facing a shortage of, we probably had a shortage of 5 family medicine providers, pediatricians. We were really struggling with hiring nursing staff, and now COVID is, and testing for COVID is a charge for our organization. To date, we have tested over 5,100 individuals, of which 300 were positive, and it is very taxing on our health center. The persons who have come out to be tested, they have a return for healthcare services. And so now we're fighting the racial equity, the COVID pandemic, and all those issues. So fighting for resources, the PPE equipment, supplies that we've been fighting for. Some may or may not know still, there's a shortage still rising. For dental, we are yet to open up our dental practice 100% because of the lack of supplies and what they need. So a huge need, additional resources will really help with that, bringing awareness to the issues with health inequities and as we fight for that. So COVID kind of ripped off the Band-Aid for some of those things that we see, and but we're here to fight those things. So I'm glad that Medicaid expansion is there. As Michael mentioned, that it would bring access to care for persons who earn $18,000 or more. That's $8 an hour when you look at it like that. And so persons are fighting to have an income of $15,000 an hour. Those are persons without health insurance and even the underinsured. When we talk about women who need access to preventive care, you know that persons of color are at risk and they're at risk and they have chronic diseases and actually they don't even have access to insurance to even fight those issues. So it's a lot, but we're here as a Federally Qualified Health Center doing what we need to do. And so I allow other persons to speak to it, but it's an eye opener for us.
So I'm happy to weigh in on this question also. And I'll start by saying I didn't think I could be any more passionate about the need to expand Medicaid. But I mean, certainly the pandemic has shown an even brighter light on how badly we need Medicaid expansion. You know, people who have access to healthcare, of course, are more likely to get tested, get treatment, even if we've got provisions for providing free COVID-19 testing. We know that just having health coverage makes people more likely to take advantage of the services that are available to them, because people really fear going to get coverage or going to get care and ending up in medical debt. So, you know, we know that that's a barrier, and if it's ever been, you know, I can't imagine when it's ever been clearer that not only do people need to have health care for themselves, but we all benefit if the people we interact with have the ability to get care and testing and treatment. I think the other thing that the pandemic has really shown a light on is that when we talk about needing healthcare safety nets, that is really not for those people over there, that's for all of us. You know, hundreds of thousands of people have lost jobs who have master's degrees and above, you know, have worked for the same large corporation that's stable for many years with what they thought was insurance, and suddenly they don't. So I think it's really highlighted something that we've seen over the years as we talk to people who are in the coverage gap, that for so many people, it really is a transient state. The question is, you know, if they have that gap in coverage, is there a program to take care of them so that they don't get sick or lose control of chronic health conditions? There have been 2 new studies that have come out just yesterday and today. One yesterday from Families USA showing that we've had the biggest drop in health insurance coverage in the nation since they started recording these things. And they estimate that 100,000 Missouri workers have lost their health insurance since the pandemic and the economic crash. That doesn't include those workers' family members. And also that in states that have expanded Medicaid, they've seen 23% of laid off workers lose their insurance. In non-expansion states like Missouri, it's 43%. And then a new study from the Center for Budget and Policy Priorities today on how states that have expanded Medicaid were in a better position to address the pandemic. So I'll drop links to both of those reports in the comments for folks who are interested.
Thank you, Jen. I have a quick follow-up question to that for you, and I'm going to a question for David. So we have Beth, who is one of our attendees, sent us a message that says, why would people be opposed to expanding Medicaid?
Yeah, I saw that comment, and it is both a basic question, but a really fair question. Because, you know, and I've worked on a lot of healthcare issues where I could see, you know, oh, this is going to help people, but yeah, you know, this group of businesses might lose income. Medicaid expansion, there really are no policy reasons not to support it. You know, it covers people who need it, it helps our hospitals, it creates jobs, helps the state budget. And so really, unfortunately, what we have seen is opposition that's based on partisanship and ideology. There are some people who fundamentally don't believe in healthcare safety net programs or safety net programs in general. You know, it's the kind of pull yourselves up by your bootstraps philosophy. And so they just don't want to cover more people, regardless of how good it is for other things. And unfortunately, there's certainly a portion of that group also that it's a lot about the fact that this came out of a bill passed when President Barack Obama was president. So we know that there is some racism and white supremacy baked into that opposition as well. But there's no policy reason to oppose it.
Well, thank you for naming that, Jen, because I think it's important to call it out for what it is. Now, David, as the lead catalyst and executive director of Forward Through Ferguson, you are leading an organization not only in St. Louis, but setting an example nationally on how to advance racial equity. And now it's great to see FTF getting engaged in Medicaid expansion. Can you share with us a little bit on why Medicaid expansion is a racial equity issue?
Yeah, absolutely. Thanks for that question. So in a lot of ways, this feels like going back to basics, like returning back to home base for us. We were created out of the Ferguson Commission, which the Economic Opportunity and Wellbeing Working Group actually centered Medicaid expansion as one of their signature priority calls to action for the region and for the state, because they recognize, as some of the other panelists have mentioned, the incredible disparities that exist and the ways that it could alleviate the inequities that we see. And on top of that, as Jen was saying, that it is a policy that would be excellent for communities across the entire state, regardless of their racial composition. And so for a lot of, in a lot of ways, it feels like returning to home base, because I think with COVID and everything, it didn't feel like a surprise to us. It more deepened our understanding. We had done a series called Visualizing Inequity that looked at the ways we had deep inequities, especially in health. Many people have heard the statistic around life expectancy, that zip codes that are, only a few miles away from each other can lead to a 20-year, 30-year life expectancy gap. And our former co-chair, Rebecca Bennett, used to talk about it as, what could you set up for your kids for the next generation with an additional 20 years of life? What lessons could you pass on to them? What ways could you set them up to thrive? But we also see that in infant mortality rates, where for Black babies, the rates of infant mortality are currently the same that they were for white babies 40 to 50 years ago. So those are the kind of disparities that we see that have only just been further inflamed by COVID, where 68% of frontline workers are more likely to be Black in the St. Louis region. And we know that a lot of those are hardworking but lower paid jobs that don't often have benefits and healthcare benefits, putting people at risk. And so that's why we really see it as a central issue for racial equity, because health is so basic of a need that you can't focus on other things like getting an education, on being able to fully work in your job. If you have health needs that mean you're unable to fully work. We see the huge costs that have economically as well. We always start with how it affects people of color specifically, but we'd be remiss if we didn't say that this hurts the entire state economically because we don't expand.
And David, I also know that you've been heavily involved in kind of the justice reform movement, and there have been some data that has produced that if there was a greater access to treatment for substance abuse or behavioral health, that there would be reduced interactions with the criminal justice system. Can you comment on that?
Yeah, absolutely. It's one of those kind of leverage points, right? If we want to change an issue or fix a problem or improve people's lives, where do we have the most leverage? And a lot of times, what's most within reach are the kind of things that are more downstream. So, and that's often, unfortunately, arrests, incarceration, people that might have mental health issues, or even outside of mental health issues, might become engaged in the criminal justice system because of other health issues that are impacting their lives. And we really push people to go upstream. Like, what are the places where we have deeper leverage? And that's where this Medicaid expansion really comes in, and can be a way that we can both save money on the back end and invest in people's lives on the front end. Like, we're the show me state. We are simultaneously leaving money on the table that wouldn't cost anything extra in taxes, while also spending more money on the back end. Something that came in our state of police reform, that Dr. Krishma Furtado on our team investigated, found that because people don't have access to affordable preventative services, like Jen was mentioning, they tend to visit the ER more often, which costs so much more than if we were to get it upstream on the front end. And we found that in the city and county, because of disparities between Black and white residents, that costs annually over $660 million just in the city county region. So imagine if you extended that across a state, if we were to able to have more preventative care because people had healthcare access.
Yeah, Michael, did you want to jump in on this one?
Certainly, I think David made phenomenal point. But an example of that is last spring, the legislators passed a bill which terminated the practice of terminating Medicaid upon being incarcerated. So we have all really discussed how difficult it is to access Medicaid. And when someone is incarcerated, their Medicaid is lost. And then we know upon reentry, though, that first year, 2 years are some of the most critical times in our community reentrants' lives. And so access to healthcare is so important. Access to continued mental health, behavioral health services are so important. And then making sure that those social supports are critical. And when we terminate Medicaid, we are waiting months just to see if you can have your health coverage reactivated. And CMS actually recommends that you suspend Medicaid when incarcerated instead of terminating it. And so just that practice alone, if ever implemented, because it hasn't been implemented yet, but it was passed, that would save us $14 million annually just in that practice. And so there's just tons and tons of data and examples that shows this is not only morally sound, but it's the fiscally responsible thing to do.
Yeah. We have Jen saying, you know, some people call the prison system the mental health provider of last resort.
And to that point, what we see is police practices and how that intersects with communities of color specifically, and how it's just not working. And so to David's point, moving upstream, being creative with the interventions that we do in community is critical. We see in North City, North County, reports released that Black men are dying still at an alarmingly higher rate from opiate overdoses than the rest of the state. And actually the state is actually decreasing. And I am personally affected by that because my uncle, whose funeral services today, he passed from a drug overdose. And so this is me literally in this moment being affected by these disparities that exist. We are not exempt as a community from any of these disparities. And so these are things that affect us both personally and professionally. And we have the opportunities to take those strides in the right direction as a state, leaving the partisan politics out of it, but really getting to care for the lives of people in the quote unquote pro-life state that we are.
Thank you.
I just want to add a little bit to that in response to David. I'm not sure how many people are aware of how many children were disenrolled within the last year from Medicaid. And part of that disenrollment was because of the transientness of the children and not being able to have families re-enroll into Medicaid. With that, dealing with the trauma of poverty. And then you add on the trauma of watching your family members suffer through COVID. Many persons have not been tested, but have actually been impacted and have suffered. So the trauma and the substance abuse and substance use, as Michael mentioned, I have personally been, in fact, impacted by that as well. And during this COVID pandemic, the rise of substance use and substance abuse, and trying to deal with the crisis of the two pandemics, is Medicaid expansion is definitely so very important. Even if it's just to put those children back into the Medicaid program and extend the services so that we can have more behavioral health services for children and or low-income persons. This is a real crisis and a great need. I just wanted to add that as we were speaking about Ferguson, and then you added that. But that's huge for us.
Andrew, I have a follow-up question to that. For those who view Medicaid expansion as primarily beneficial to urban and African American communities. How do you respond to that?
Well, I respond by saying that's not true. Trauma is impacting everyone. And we have no idea how we suffer. As you know, the rural communities are really suffering. They have closed so many hospitals. We have, as members of the Missouri Primary Care Association, we've attended many sessions in Washington, D.C., all of the CEOs from the FQACs and board members of our health centers are persons who live within the communities of the health centers that they serve. And so many rural board members have shown up to fight for healthcare services. They lost their hospital systems. Some of the FQACs in rural America is in Missouri are functioning as a hospital system. They are not equipped to serve emergency services, and that's what they're doing right now. And so it's a huge crisis. This is not about urban. This is not about African American. This is about equity for everyone, and this is a health crisis. And healthcare is not always physical. It's mental. It's substance use. It's a lot of issues involved in healthcare that we need funding for.
And to add to that, Cynthia, since 2014, we have had 10 rural hospitals closed. And the reports that are being done to really check the sustainability of hospitals throughout the state say 26 more are vulnerable if Medicaid is not expanded. And so we see that this does in fact really extend beyond our urban and suburban cores into our rural communities. But not only that, the 16,000 jobs annually that will be created by Medicaid expansion, 60% of those will be in our rural communities. In addition to that, about 71% of all people who will now be eligible when Medicaid is expanded are white and individuals from our white communities. And so we want to be sure to highlight that to the point that many of the panelists have shared, that this expands well beyond just what the myths and misinformation out there is telling us about communities of color and urban healthcare service delivery. This really ensures that we can not only protect and address the inequities that exist amongst Black, Brown, and other communities of color, but we can also address access to those who are vulnerable living in our rural communities as well.
May I jump in with a couple more quick things? First off, I can't pass up the opportunity to say that any chance we have to sort of combat these false choices is important. So it is true that Medicaid expansion, helps a whole lot of rural and white people who are not always the same people. But I also think when we have the opportunity to push back on, the idea that we shouldn't support something because it benefits Black and urban communities, I think this would be a valid policy if it only impacted Black and urban communities. As it is, we know that, we have enough data from other states to show that expansion states have substantially decreased the race-based disparities in health insurance coverage. There's also data showing that expansion states have eliminated the uninsurance rate gap between low-income folks in small towns and rural communities and low-income folks in urban and suburban communities. Not even narrowed, but actually eliminated the disparities in coverage for those communities. So yes, it benefits everybody. And Angela, just quickly, I think you're raising the Medicaid purge is so important also. That's what we call, this 2-year, just really, it's a purge of mostly children from our program who were always eligible. They never should have been dropped. And, frankly, it was through aggressive dropping of people, and our current administration just bald-faced lied about why it was happening, and they changed their story constantly. And that, that goes back to Beth's question about who opposes this. It's the same people who were allowing 100,000 kids to lose their coverage and spinning message points about why that was that weren't accurate. And we're going to need important for folks to know to do everything we can to pass this on August 4th. We also don't get to put the issue to bed on August 5th because we're going to need to stay vigilant and make sure that it gets implemented in our so people actually get the care they need.
Just a couple of quick questions, like how many people in Missouri will benefit from the expansion of Medicaid?
So the estimated amount is about 230,000 individuals will benefit from the expansion explicitly through access to care. We know that COVID has disrupted that figure a little bit. And so it will be higher potentially. However, everyone is impacted. We're talking about 1 billion or 1 billion plus of federal tax dollars coming back to our state. We're talking about 16,000 jobs annually in our urban and rural communities. And so although that 230,000 has access or explicitly is impacted by that, all Missourians will feel the impact of that money coming back to our state, because we see even just in recent weeks that education is being cut. And so we have significant budget constraints. And so it is our responsibility to ensure that we are getting our tax dollars that we're already sending out of the state back to Missouri.
And another question that's come up in the chat, can anyone speak to how the expansion of Medicaid might benefit, or doesn't benefit undocumented immigrants in the state of Missouri?
Briefly, unfortunately, that's a problem that remains even after expansion. Yeah. It doesn't benefit folks who are undocumented. That's a fight we have yet to fight.
And then when we're talking about go ahead, I'm sorry.
I can add a little bit. Indirectly, it will benefit from an FQAC standpoint, because as a federally qualified health center, our mission is to serve any and everyone that's uninsured and underinsured. So if we have resources for those, if we can insure more, then we can have access to care to undocumented immigrants and other populations of need that are vulnerable. So this will help indirectly, but it's not a direct benefit, but it will be a huge indirect benefit for the population, for an FQAC point of view.
I want to encourage our attendees to send in your questions. We have a few more minutes left, and we have Bethany who's asking, for someone who's pro-choice or someone who's pro-life, why is Medicaid the right choice for Missouri?
I could jump in here. Thank you for the question, Bethany. Awesome leader in our community who I get to call my direct leader. So thank you for that question. One of the things that we see in particular with the Yes on 2 campaign is one of the most diverse coalitions of organizations that have endorsed an initiative that Missouri has ever seen. And part of that coalition is a broad range of faith organizations, including our Catholic churches, our Protestant churches, our evangelical churches, in addition to our Jewish community, Muslim community as well. And with that being said, what we want to point out is what Medicaid expansion does, as communicated by various faith organizations, is ensure we are taking care of the lives and serving those who need served the most in our community. And no matter your religion, those are principles and teachings in all of those religions in some capacity. So really making sure that we can serve those beyond the womb. In addition to that, really addressing those inequities that we see around infant mortality and maternal health, and not disrupting care delivery postpartum and so forth. And so that's one of the things we really just want to point out is we really celebrate the diversity of this coalition, and that many faith groups have said this is the right choice.
May I ask the would you like to go ahead, Jen? Go ahead.
Two quick things. One, simply on its face, of course, and people are saying this, of course, it's a pro-life stance because it will literally save lives. People are dying because they're uninsured. Also, I think, a lot is made of the differences between support abortion rights and people who oppose abortion rights. There's plenty of overlap too, right? I would say no matter what people think about abortion, whether it should be legal and available, I think most people would agree that women should not be forced to make choices that they don't want to make, whether that's terminating a pregnancy or placing a child for adoption because they don't have access to the resources, including the health care that they need to make the choice they want to make. And so, I think this is a really great example of an issue where we shouldn't let divisions on one small thing divide us on something that supports all of our values.
Thank you, Jen. I have a question for the panel that has also come from the chat, and that is, how has the urgency and awareness and outreach been advanced to key communities in our region, in St. Louis and beyond?
So some of the strategies that the campaign has really ensured to implement as we get closer to August 4th are three things. One, we want to make sure that we are raising awareness, dispelling any misinformation for those likely supporters. We know that we cannot celebrate a lead. We have to push through the finish line and make sure that supporters and those on the fence really know what the key information, the talking points, and the impact does for the state of Missouri. And so part of those strategies is our GOTV, Get Out the Vote strategy. You should be hearing radio ads and TV ads. We just released another one yesterday, and so you should be seeing that. In addition to that, the campaign's equity and inclusion director really has worked very diligently to ensure that we are including all communities, but specifically those most marginalized throughout the state. So you see her efforts being pushed in the Boot Hill, Southwest Missouri, Kansas City, St. Louis, with leadership tables and those champions to inform communities who have had inactive voters about Medicaid expansion and what it really means and the significance of this moment. Then next, there is phone banking, text banking, the field director and the field activities, and then MOVE has really been working very diligently to engage all registered voters throughout the state, make sure that they're aware, make sure that voters in support can have bumper stickers, t-shirts, yard signs, all of those things. And so you can go to yesonto.org for more information. I've put my contact information in the chat several times. I'll put it in again. Please feel free to reach out. If your organization wants to endorse to have access to the communications toolkits, to the social media toolkits, it's all there because these resources are all of our resources. We want to make sure that we're spreading the word so that we can, again, can not only bring those tax dollars back and expand access, but just create a spark in economic mobility upwards instead of seeing some of the status quo and trends we're currently seeing.
And I just want to give kudos to the campaign and to the MOVE collaborative too, particularly because of this time that we're in and the way that access and the right to vote is being challenged both by the pandemic and the wave of kind of voter suppression and making it more difficult to vote, that we know has racial equity implications for who has barriers erected in front of them. So just want to give a shout out and celebrate that you all are being so intentional about that.
Thank you, David.
Go ahead.
And I just want to reiterate that this is not the campaign's initiative. This is Missouri's initiative. We know that the legislature was inactive on expanding Medicaid, and it requires signatures from all of the 8 districts throughout the state to get this on the ballot. So this is the people speaking up saying we've had enough. We want to be able to dictate policy in our state, and this is the chance for us to do that. So while there is a select few that are leading the campaign in administrative capacity, there has been so many people who have chipped in to ensure that we are spreading the word, making sure that people are aware, getting people registered to vote, making sure that people feel safe to practice their constitutional right to vote. And so I do thank you, David, but to that point, this is something that Missourians throughout the state should applaud themselves on, but that's not enough. We got to make sure that we get Medicaid expanded.
True. I have a question for you, Angela. Can you give us an idea of what type of changes in healthcare or health outcomes might citizens realize if Medicaid is expanded? What difference might we see?
Well, improvement in health disparities. Let's just talk about diabetes. For now, which is part of the trust issue when we talk about racial inequity, many of the African Americans felt that when the message came out that they were at risk because of their health inequities, they felt that it was not true, and that this was a plot to against our community. But bringing awareness to our community that it really is true, and that you are at risk because of your healthcare status, and that being diabetic is a risk, and having uncontrolled diabetes is a huge risk, and part of that is lack of resources. So Medicaid expansion will definitely improve that, because most persons will have access to care. Health education and prevention will be one of the huge issues to help educate our community. The other side of seeing healthcare outcomes, and I'm just a strong advocate of this right now, is the behavioral health side, and making sure that we can have more behavioral health consultants to deal with the trauma, to make sure that we have healthcare into the school systems, because our children are our future. And they, when you deal with trauma and your child is sick, you can't go to work. And if you can't go to work, you lose income to even take care of yourself. So having healthier children, right now the immunization rates are extremely low. Before COVID, because we changed some of the guidelines. But when you have sick children and they can't attend school mentally and physically, just to improve that, expanding healthcare into the school systems. So having more providers into our community, nurses being able to compete. We lost so many doctors and nurses to other communities that expanded. And so just being able to compete and actually recruit persons to our region. If we can have $1 billion invested into our region, then we know we'll turn our region around. We won't see as much blight, and we will have persons working, and having access to care would definitely improve the community.
One of the issues that I wanted to raise too is that one of the biggest challenges for the uninsured or the underinsured is the real medical debt that comes from not having proper coverage, which can lead to personal bankruptcy and really create a debilitating effect to generating or creating wealth over time. And I think so when we look at Medicaid expansion, it's also an anti-poverty effort across the community. And what we've been seeing in the chat, which is really quite wonderful, is that folks are asking, how can they get engaged to help ensure that Medicaid is expanded in the state of Missouri? And I wanted to throw that out.
I'd love to offer a list, or Michael, do you want to go first?
No, go ahead, Jen. I'll follow you.
All right, I saw someone ask for the top 5 things. So my list is number 1, share the information with your people. Share all the information you can find with all the people you can find. Tons of stories and data and studies and everything you can. Someone noted that they're not seeing any no on to ads yet. That's awesome. We want to be preparing people with the information they need to be prepared if we do see those ads. We want to make sure people have the information they need before they see them and that they hear about it after they would see them. There are lots of volunteer opportunities. I'm guessing Michael will go more into those, but there will be huge opportunities, phone banking and text banking. I know that you can sign up through the campaign. You can also sign up through our organization or any of the MOVE organizations that have been mentioned. Help folks navigate voting during the pandemic. You know, there are options that people have for mail-in ballots and safe ways to vote, and some of them are different than most years, so helping people figure that out. Sharing personal stories, and I think we have a natural example on this call, which is that first off, Michael, just condolences and much love to your family on the loss of your uncle. I would also hazard a guess that people are going to get off this call and they're going to remember you and your story and not the statistics that I threw out earlier on this call. People remember people's stories and we care about other human beings. So if you have a personal story, share it. If you know people with personal stories, share it, whether that's through your own feed or we collect stories. I know the campaign collects stories also. So those are one of the most powerful tools we have to help people understand, you know, who this is really all about. And then number 5, finally, is just remind people to vote. Remind them. You know, if you're sick of saying go vote yes on August 4th, that's maybe when people are starting to actually hear what you're saying. So say it over and over and over again until 7 o'clock on August 4th, and together we can get there.
So I'll start by say yes on 2, yes on 2, yes on 2. That's the first step. But to just add to what Jen had mentioned, there are several things you can do. I just posted the link, the Get Involved link, where you can go there, volunteer for phone banking, text banking. Your organizations can host a phone banking party where we can train you, get you scripts up and running, and so that you can reach out to individuals. But we know that the most impactful way to organize is through relationships, those relational organizing. So making sure that you're texting friends, family, so that they're aware. We all hate those Facebook chain letters and email chains, and I get it, but this is an extremely important moment in our state, and we want to make sure that people get that information. In addition to that, you can do some pre-troubleshooting before Election Day. And so making sure you understand where your precinct is to vote, what is happening in your communities. But then in addition to that, supporting those who are high risk. And so we still have time to apply for absentee ballots. And so if you are high risk or you are a caregiver for someone who's high risk, go request an absentee ballot and ensure you get that in. However, if for some reason you don't get that in, you can still show up to the poll, turn it in, and vote. And so we want to be sure that everyone can practice their constitutional right to vote. Then lastly, for those who want to get involved, showing up and volunteering at your polls. We know that August in Missouri is hot. We expect, because of social distancing, lines will be long. There will be long wait times like we've seen in other states. And so just caring for your neighbor, making sure that we have masks, making sure that those waiting in line have water, hydrated, just little things we can do to love one another during this time so that we can ensure that we're safe. We can ensure that we are taking care of one another, but most importantly, we are saying yes on two to take care of our state as a whole.
Thank you, Michael. I want to offer Angela and David some parting thoughts as we have our program concluding.
I just want to say thank you all. Great discussion. I'm glad to hear a lot of comments about staying safe. Staying safe. Please stay safe. We see our numbers are rising and persons are afraid about going out during this pandemic. And so if you belong and serve on social groups, fraternities and sororities, help them, reach out to them to help during that day, especially passing out masks and whatever is needed for the community.
Yeah,
and or get tested.
Definitely raising up that. Yeah, that's just really incredible to be on this panel, and so excited by the movement across Missouri, and can't wait for this to be successful, and the voices of Missourians across the state being heard, and to see the way that this can shift the future of the region. And I'm so excited to see the widespread impacts it'll have both on people's lives directly who have greater access to healthcare, but absolutely, as so many people have mentioned, the ways that it'll make our entire state more resilient, more thriving, and a better place to live.
Great, thank you so much. I want a special thank you to my co-hostess, Cynthia Williams. It's always a pleasure working side by side with you, Cynthia. And I also need to thank Janet Kilo and Atia Thurman, who work behind the scenes. I hope you will join us for part 2, which is Wednesday, July 22nd, a week from today at 12:30 to 1:30, where we're looking at Medicaid expansion in rural communities. The link to register is in the chat feature. And please join me in thanking our panelists. We're so very grateful for your time and for your efforts in just pushing this state to a much healthier place and doing it with racial equity at the forefront. So thank you all.
Thank you so much, panel.
Thanks, everyone. Have a great day. And
Have
yes
a
on
good
two.
day. Thank
Have a
you.
great
Yes
day,
on
everyone.
two. Yes.